project is on muscular dystrophy. This is defined as the progressive weakness and loss of muscle mass. Abnormal genes or mutations interfere with the production of proteins needed to form healthy muscles. Signs and symptoms of muscular dystrophy include frequent falling, difficulty rising from lying or sitting positions, trouble running and jumping, a waddling gait, which is the weakness of proximal muscles of the pelvic girdle. So they will have a short stature and sway side to side, sort of like a duck does when it walks. They will also have a Gower sign, which is using their hands to guide themselves up, almost climbing up the legs to get to an upright position, and I'll include pictures of those two in the next slide. They also walk on their toes, have large calf muscles, muscle pain and stiffness, learning disabilities, and delayed growth. There are two main types of muscular dystrophy. The first one we'll look at is Duchenne, or DMD. This is the most common. Girls can be carriers and mildly affective, but it is much more significant in boys. This type of muscular dystrophy includes all the symptoms listed on the previous slide, and those signs and symptoms can occur in ages 3 to 5. The second type is Becker. It's similar to Duchenne, but more mild and the progression is slower. This type begins during adolescent years, but sometimes it can be as late as mid-20s. There are also specific types of muscular dystrophy. These are defined by the specific feature or by where the symptoms are located in the body. The first one is myotonic, which is the inability to relax muscles following contractions. This can be as simple as difficulty ungripping a pencil, though usually facial and neck muscles are affected first. Some physical signs can be long, thin faces, drooping eyelids, and some may have swan-like necks. Another type is FSHD. In this one, the muscle weakness begins in the face, hip, and shoulders. The shoulder blades may stick out like wings when their arms are raised. This usually begins in adolescence, but it also can vary from early childhood to late 50s. There's congenital type. This is apparent at birth or before age 2. Even though muscular dystrophy is much more common in boys, this can affect boys and girls. Some progress slowly and only form a mild disability, while others may be severe and rapid. For a limb girdle, the hips and shoulders are affected first. They might have difficulty lifting the front parts of their foot, so this causes them to trip a lot. These statistics will be based on the Duchenne type of muscular dystrophy. 1 in 3,500 worldwide are affected by this disease. About 250,000 in the United States. Patients are usually unable to walk past the age of 12, and the average age for diagnosis is 5 years old. Previously, most affected did not live past their teenage years, but advancing technology is increasing life expectancy to as long as their 30s or 40s. Muscular dystrophy is classified as a genetic disorder, so it would fall under nature. Muscular dystrophy is an X-linked recessive inheritance, which is passed on by the mother. She is considered a carrier. Most of them do not have signs or symptoms of muscular dystrophy. It occurs when there's a lack of the gene dystrophin. This is the protein associated with the disease that, when lacked, causes muscle cells to become fragile and degenerated. It hasn't been shown to be more or less common based on ethnicity and race. No family history of muscular dystrophy puts children at a higher risk of development or higher risk of becoming a carrier of the gene. It hasn't been found that nurture has any effect or role on the development of muscular dystrophy. Some physical effects would be heart problems, difficulty walking, and this leads patients to have to use a wheelchair as the disease progresses. Chewing, breathing, swallowing, and speech problems. Shortening or shrinking of the muscles, which causes joint problems. Abnormalities in the brain. This can cause seizures. They're more at risk for choking and recurring pneumonia, and also scoliosis, or a curved spine. Cognitive effects would be delays in speech and language, mental retardation, increased risk for lower IQ, central nervous system abnormalities, which include dendrite defects as well as loss of neurons. Brain atrophy has been associated with it, and that is the loss of and weakened connection of brain cells. Cognitive functions are impaired by the absence of dystrophin. It'll become hard for children with muscular dystrophy to keep up with other kids during physical activities like recess, sports, and games. This causes a lack of peer relationships and friendships, and this can lead to anxiety and depression. There are several tests you can use for diagnosis. One would be the enzyme test. High levels of creatine kinase indicate muscle disease. They can then use this to test whether or not this is muscular dystrophy. Genetic tests will take blood samples that can be examined for the mutations caused by muscular dystrophy. A muscle biopsy would be to take a small piece of muscle and then analyze that tissue and determine the differences between the muscular dystrophy and other muscle diseases. You also would check for heart and lung functions and dysfunctions. Electromyography. This is a needle that's inserted into the muscle, and electric activity is measured through that needle as the muscle is relaxed and then gently tightened. There is no known cure for muscular dystrophy, but treatments can increase life expectancy as well as the time patients can remain mobile. Therapy trials are ongoing and technological advances are in progress. They have been able to increase life expectancy about 20 or 30 years. Some treatments include being monitored by a neurologist, rehabilitation doctor, physical, occupational, lung and heart specialists are also recommended. Braces, mobility aids, and breathing assistance will likely be needed with this disease. There have been medicines approved by the FDA within 5 years that have been shown to improve symptoms by muscular dystrophy. An educational program I found was Parent Project Muscular Dystrophy. It provides families with medical research, clinical trials, information regarding symptoms and treatments, advice and recommendations, and it also lists resource centers available. It also serves as a donation site. This study's title is Gene Therapy as a Potential Therapeutic Option for Muscular Dystrophy, a qualitative preference study of patients and parents. There were 17 parents of children with muscular dystrophy as well as 6 adult patients. They participated in a hypothetical survey on gene therapy, which is a new therapeutic development of muscular dystrophy. It has the chance to stabilize muscles, increase cardiac and pulmonary function. It was stated in the survey that there's a 1% chance of death associated with it, but the benefits can last 8 to 10 years. The study was analyzed on a Microsoft software called NVivo. It's a qualitative data analysis, and this helps organize and analyze survey responses that are non-numerical. All the participants placed a high value on skeletal muscles, specifically early on in the disease. They then placed cardiac and pulmonary functions later on as the disease progresses. Over half the participants tolerated the hypothetical risk of death, initiated in the question. That number increased as it progresses. Most of the participants didn't want to do the treatment early on. They waited until, quote, a highly valued function was about to be lost, unquote. Since genetic therapy is becoming more prevalent in the area of finding a cure to muscular dystrophy, the study's function was to see if people affected would be willing to take part in clinical trials and if they would continue on to do the treatment.